Hello, and thank you for joining us this evening. My name is Ann Risso, and I am the Community Relations Coordinator for the Communications Department at Douglas County School District. Welcome to the first District Parent University webinar of the 23-24 academic school year. And with the help of our partner Skyridge Medical Center, this program aims to provide monthly, engaging, and relevant content to Douglas County School District parents and caretakers. Today's topic is about concussion process and school sports, specifically how Douglas County School District cares so well for our student athletes. The content of this Parent University webinar has been created by our district athletic and events department, specifically Chris Mathewson. Chris serves as the director of athletic training for Douglas County School District and is also entering his 30th 30 season, excuse me, of as the head athletic trainer of Ponderosa High School. This webinar, a little background on Chris there. This webinar also has additional information from Douglas County School District BrainSTEPS Committee. The BrainSTEPS Committee provides resources, consultation, and training regarding both concussion management and brain injury for our school district. Hopefully you've had a minute or so to look over Chris's bio. You can see all the things that he's achieved, and he has also received several awards for his efforts as well. Now I'd like to start the presentation that Mr. Mathewson has created specifically for this webinar.
Hi there. Thank you for attending this Parent University presentation. Douglas County School District Athletic Concussion Management Program. My name is Chris Mathewson. I'm the head athletic trainer at Ponderosa High School. I've been at Pondo for 30 years. I'm the lead athletic trainer for Douglas County School District. I've been doing that for 25 years. What I'm going to cover today in my presentation: an introduction to the athletic training team, concussion basics and recognition, our components of our Douglas County School District concussion management process, clients, and then I'm going to go through an example case. Douglas County School District athletic trainers. It's a group of people that I'm very proud to lead, and I believe we have a wonderful team. At Castleby, we have Tom Bradley. Chaparral, we have Sue Timke. Douglas County, we have Angela Ballastina. Highlands Ranch, Tom Silva. Legend, Sarah Kramer. Mount Vista has Joe Eckhoff. I'm at Pondo. Taylor Quesner at Rock Canyon. Lauren Hatch is at Thunder Ridge. Maddie Englund is our float athletic trainer. She covers all the schools. Our medical director is Dr. Michael Fuller. Okay, so let's cover some basics about concussion and some recognition. CDC has a clear and concise definition of concussion. Traumatic brain injury disrupts the normal functioning of the brain. A bump, a blow, or a jolt to the head can cause a TBI. These injuries range from mild to severe. Mild TBI, referred to as MTBI or concussion, is the most common. With the brain still developing, a child is at greater risk for long-term effects after a TBI. All concussions are serious. Most concussions occur without the loss of consciousness. Proper recognition and response to concussion can prevent further injury and help with recovery. In Douglas County, we average nearly 200 concussions suffered with our high school athletes a year. On average, those athletes miss 22 days of athletics for each concussion. Signs and symptoms of concussion. A sign is something you can see. Symptom is something that is reported by the athlete. Signs and symptoms of concussion can show up right after the injury, or they may not appear noticed until hours or even days after the injury. Signs and symptoms observed. The athlete can appear dazed or stunned, is confused about events, answers questions slowly, repeats questions, can't recall events prior to the injury, shows behavior personality changes, or they're forgetful. Reported cognitive symptoms of a concussion are difficulty thinking clearly, difficulty concentrating or remembering, feeling slowed down more than usual, feeling sluggish, hazy, foggy, or groggy. Reported emotional symptoms can be irritable, sad, more emotional than usual, and nervous. Some reported physical symptoms can be a headache or pressure in the head. This is probably the most common. Nausea or vomiting, balance problems or dizziness, fatigue or feeling tired, blurry or double vision, sensitivity to light or noise, numbness or tingling, or sometimes they report just they generally don't feel right. Sleep. Sometimes they feel really drowsy. Sometimes they sleep less than usual, sleep more than usual. They have trouble falling asleep. What are concussion danger signs? Be alert for symptoms that worsen over time. Immediate emergency evaluation is needed if any of these are present. One pupil is larger than the other. Drowsiness or cannot be awakened. A headache that gets worse and does not go away. Weakness, numbness, or decreased coordination. Repeated vomiting or nausea. Slurred speech. Convulsions or seizures. Difficulty recognizing people or places. Increasing confusion, restlessness, or agitation. Unusual behavior, or loss of consciousness, even if it's brief. Now let me go over the components of our Douglas County School District management process for concussions. Several different pieces make up our program. Current research and best practice, standardized assessment of concussion, concussion education, modified academic requirements, neuropsychological testing, symptom tracking, physician referral or release, a progressive return to sport, and complex or prolonged concussions. I'll go into each of those components in depth here. Current research and best practice. Management of concussion has changed dramatically over the past 20 years. No longer are concussions graded. Back when I was in high school, you had, oh, it was just a grade 1 concussion or a grade 2 concussion, or since he was knocked out, it was a grade 3. No longer do we grade them. And there's no such thing as something as minor as just getting your bell rung. All concussions are serious. Berlin guidelines. Douglas County School District Athletic Trainer Group management practices are based on the 2017 Concussion in Sport Group. The consensus statement, also known as the Berlin guidelines. In 2022, they were updated and now they're referred to as the Amsterdam statement. Each consensus statement summarizes the most recent evidence-informed principles of concussion prevention, assessment, management, as set forth as the gold standard for care and concussion in athletics. Standardized assessment of concussion. A crucial component is a universal tool for assessing concussion. What is a concussion at Ponderosa is also a concussion in Mountain Vista. Douglas County School District uses the Standardized Assessment of Concussion, or the SAC. The SAC is a standardized means of objectively documenting the presence and severity of neurocognitive impairment associated with concussion. Concussion education. Athletic trainers provide families basic concussion information at the start of every season. Following any suspected head injury, the athletic trainer will send home an athlete with a concussion information sheet. And all our coaches in Douglas County School District must complete the CHSAA Coaches Concussion course. Modified academic requirements. Current research supports adjusting academic load during the recovery period of a concussion. When an athlete is diagnosed with concussion or is reporting concussion-like symptoms, the athletic trainer will inform the building nurse or the appropriate TBI management team member the notice of concussion. And then they'll put in place the academic restrictions or modifications that are necessary. The modifications or restrictions remain in place until the athlete has begun the return to sport protocol. Neuropsychological testings. Computerized neurocognitive testing will be used as a tool in concussion evaluation, but will not be our standalone decision-making tool for diagnosis or return to play. Specifically in Douglas County School District, we use SWAY for neuropsychological baseline testing and sports injury. Athletes who participate in contact sports, football, basketball, baseball, wrestling, cheerleader, lacrosse, soccer, softball, gymnastics, flag football, ice hockey, and field hockey must complete a baseline test before engaging in his or her sport. When an athlete is determined to have a concussion, whether through the results of a SAC exam or direct diagnosis from a qualified medical provider, they must complete a SWAY post-injury test. The SWAY post-injury test should be given no sooner than 3 days following injury. Another component to our management system is symptom tracking. Concussed athletes will be asked to check in with the athletic trainer to report his or her symptoms throughout the recovery period. At a minimum, this should occur once a week. For Ponderosa, I have the kids come in daily and they complete a Google sheet that logs all their concussion symptoms. Another component to our system is physician referral and release. Douglas County School District head injury physician referral form will be given for completion by the qualified healthcare provider and returned to the athletic trainer. In compliance with state law, only these healthcare providers may provide clearance. MD, DO, NP, PA, a licensed doctor of psychology with training in neuropsychology or concussion evaluation and management, and a licensed physical therapist with training in pediatric neurology or concussion evaluation and management. Progressive return to sport is another component to our concussion management system. An athlete may begin the return to sport progression when the SWAY post-concussion test scores have returned to normal, no scores outside the reliable change index, and number 2, the athlete reports no concussion symptoms for 48 hours, and number 3, a qualified healthcare provider has released them to return to sport. Progressive return to sport. The purpose of progressive return to sport protocol is to gradually increase exercise intensity, duration, and complexity to ensure a safe return to full activity. Each return to sport progression will be directed by the DCSD athletic trainer. Each step must be separated by 24 hours, and any recurrence of concussion symptoms should lead the athlete to dropping back to the previous level. Let me go over the steps we have. Step 1 is symptom limited activity. It's just the daily activities of life that do not provoke symptoms. The goal is to gradually reintroduction of work school activities. The secondary goal is to gradual introduction of subsymptom threshold exercises. Step 2, progressive return to sport. Light aerobic exercise. Walking or stationary cycling at a slow to medium pace. There's no resistance training at this time. The goal is simply to increase the heart rate. Step 3 in the progressive return to sport is sport-specific exercise. This is running or skating drills, no impact activities at this time. The goal is to add movement. Step 4 of the progressive return to sport is non-contact training drills. This is harder training drills, for example, passing drills, agility type stuff, and they may start progressive resistance training at this time. The goal is to exercise and increase coordination and intensity. The 5th step in the progressive return to sport is full contact practice. They're allowed to go back to normal, full practice at this time. The goal is to restore the confidence and assess any functional skills or deficits by the coaching staff. The final step is in the progressive return to sport is full sport return. The activity is normal gameplay. The goal of that is the completion of the protocol. Okay, complex or prolonged concussions. Athletes who experience a complex, meaning presence of significant number of signs or symptoms, or prolonged concussions, meaning greater than 4 weeks to return to normal play, may be referred to the Douglas County School District Brain Injury Resource Team for consultation and review of the case, and or possible referral for specialty care. The Douglas County School District Brain Injury Resource Team, the athletic trainer, outside medical provider, and parents will work collaboratively to return the athlete to academics and athletics. If an athlete suffers multiple concussions reported or diagnosed in the school year or through their course of their lifetime, they must complete a review by the team of several entities. The review team shall consist of, at a minimum, parents and guardians, athletic trainer, Douglas County School District Brain Injury Resource Team, or the treating physician. Decisions on resuming athletic participation in non-contact sport, or permanent athletic retirement will be based on the long-term health consequences of continuing to compete. The best health interest of the athlete will be the only determining factor, with consideration for physical health, cognitive function, and the ability to perform academically. Compliance. So let's talk about how Douglas County School District complies with state law and CHSAA bylaws. During the 2010-11 school year, the Colorado High School Activities Association, CHSAA, adopted 2 bylaws regarding concussions. The first, 1620.5, all athletic coaches must annually compete one of the following: the online NFHS concussion course or the school organized sports medicine review that includes a head trauma concussion component and emergency evacuation procedures. Second bylaw they came up with that time was 1780.21. And if any time during participation, practice, or contest, a student athlete is removed from participation due to head trauma, the student athlete must obtain written permission to start the return to play protocol from the approved list of healthcare providers. The school or school district may impose stricter standards. There's also a state law that regulates concussions. The Jake Snakenberg Youth Concussion Act. This requires immediate removal from play of an athlete suspected of sustaining a concussion. It requires notification of the parent or guardian of the injury, and then also requires written clearance from a qualified healthcare provider to allow athletes to return to athletic activity. Based on our current program, Douglas County School District is in full compliance with the two CHSAA bylaws and the Jake Snakenberg Youth Concussion Act. Now let's go over an example case. I think this will be helpful in kind of seeing how the system works. We're going to have a pretend athlete. I call him Douglas County. That's his name. He's a 16-year-old soccer player. He plays goalie. He had a collision with his opponent in which he got kicked in the head, landed on his shoulder, which caused a whiplash mechanism of his head. By attending to him out on the field, eventually he was able to get up and walk off the field. Myself, I always do. I call it the cool off and hydrate period. So I got him out of the game, got him on the bench, kind of calmed him down. I gave him a water bottle and kind of just have him sit there for a little bit, cool off, collect themselves, gather themselves. And I'm watching them and sitting with them most of the time, but it's really just to kind of calm them down at that point. Okay, then I administered the SAC test. At that point, Douglas County had no previous history of concussion. In the first section, orientation, he scored a 5 out of 5 on the orientation. That's where I ask, what month is it? What day is it? The current time, the year, those types of questions. Next part, in the immediate memory section, he got 14 out of 15 correct on the immediate memory. That's where I give him 5 words to remember. In our case, it's elbow, apple, carpet, saddle, bubble. He says them, repeats them back to me, and then he has to say them a couple times. He got 14 out of 15. For the next part, the neurological screening, everything was negative except for he could not perform tandem gait, which is walking with your eyes closed, your head tilted back, heel to toe. He was very wobbly on that. On the concentration section, he got 3 out of 5 correct. Concentration's where I give him a list of numbers, 493, and he has to say them back to me backwards, 394. He got 3 out of 5 right on that section. For the delayed recall section, he got 4 out of 5. That's where I ask him again, what were those 5 words? Elbow, apple, carpet, saddle, bubble. He got 4 out of the 5. Taking his totaling it all up, he got a 26 out of 30, which for Douglas County School District, 25 is our bench line for 25 or higher is the bench line for our passing score. Also part of our SAC exam is the symptoms reported. For Douglas County, he had a headache. He listed it as moderate. He had nausea, which he considered mild. And he had dizziness, which he considered mild. So although he did score 26 out of 30, he did have symptoms. Consequently, he was removed from the game. He was considered concussed. So in our example case, following the game, I spoke to the parents and provided him, explained the situation about concussion and what to look for. I provided them the take-home document, things to watch out for, and really kind of explain what to expect. So that injury to Douglas County was on Thursday. We didn't have school on Friday, so I checked in with him over the weekend via text to see how he was doing. We made arrangements for him to come in on Monday to do a post-injury SWAA exam. In that, his test results were 5 out of 6 metrics that we covered were significantly changed from his baseline scores. Because of that, he was placed in the concussion program. So with the exam, following the test, I reached out to his parents and gave him the results of the test. And I sent him home with this sheet that I developed at Ponderosa called, "You've been diagnosed with a concussion, now what?" So it talks about how we're going to manage it immediately, and then what he'll have to accomplish to return back to soccer. Later that afternoon, I reached out to our school nurse to let her know that Mr. Douglas County got a concussion and he needed to be on modified academic requirements because he is now in the concussion program. So I asked Douglas to come in every day, and he grabs our iPad that's in the athletic training room and he logs his symptoms on a Google form that I have. It took him 12 days before he really got back to where he felt like he was completely back to normal. He stopped reporting any types of symptoms, and he said he really truly thought he was himself after 12 days. So based on that, I said, okay, let's arrange to do a sway test the next day. He took the sway test again, and at that point, all results indicated that all metrics had returned back to baseline. Consequently, he was ready to be referred to the physician for evaluation and release. The physician saw him and felt the concussion was resolved, and the athlete was able and ready to begin the concussion return to play program and our progressive return to play sports. So we've developed to help us, because we can get so busy, cheat sheet, if you will, it's based on sport and it's based on the steps. And so he's step 1, soccer. I look at the sheet and I know where we're going to start. Okay, so following that day of doing step 1, next day he came in and he reported no symptoms. So I'm like, okay, great. We can go to step 2, which is now he can do a little increased activity. Following step 2, he came in the next day and reported that he had no symptoms. Fantastic. So I'm saying, okay, well, let's go to step 3. Step 3 is he can do some agility workout, some burpees, mountain climbers, that kind of stuff at 50% intensity for about 20 minutes. The next day he came in, he reported no symptoms or any aggravation of any type of how he was feeling. So it was great. He can go to step 4. Based on that, he's able to start some agility type stuff and some sport specific type training and really get in there and start trying things out. The next day he came into me, reported no symptoms after performing those exercises. Great. So now you can go to step 5. Step 5 is full practice. So he practiced full that day and did great. The next day he reported to me no symptoms. So at that point he is full release. I hope you can kind of see, after following this example case, how we take each step. For this, again, Douglas County athlete, it took him a total of 19 days to get back. Like I said, our average is 22 days missed, so it was a pretty typical case. Lastly, I'd like to provide you with some take-home points. Douglas County School District take concussion very seriously. Our concussion management program is based on current research and published best practice. The program is evaluated and adjusted annually. And then lastly, I know I'm biased, but I hope you can see that, or hope you believe this is true, that we have really good people working hard to keep our kids safe in Douglas County. Thank you for your time and attending this. Here's my contact information. If you have any questions, comments, or concerns, please feel free to reach out to me.
Thanks, Chris, for that very informative presentation on concussion protocol. And I absolutely agree that you have very good people taking care of our kids. Shifting gears a little bit here, pun fully intended. Next, we have a presentation about the Douglas County School District BrainSTEPS Committee. And Chris had mentioned that in his presentation. And BrainSTEPS stands for strategies, teaching educators, parents, and students. A little more information about them. And I would like to mention that all of this information from the BrainSTEPS is courtesy of Dr. Stephanie Crawford. She is the mental health director at Douglas County School District and the BrainSTEPS co-lead. So obviously you can take the time and to read this information another time, but I'll just kind of hit some highlights here. The Brain Injury School Reentry Consulting Program was modeled after Pennsylvania's BrainSTEPS program, and it was started in 2007. And as a result of acquired brain injury, many students return to school with lingering effects that impact their classroom performance. I think a lot of us have experienced that as parents. BrainSTEPS in Colorado has been designed to consult with school teams and families in the development and delivery of educational services for students who have experienced acquired brain injury. Next slide. The, BrainSTEPS Committee is a multidisciplinary group of volunteers with specialized training who meet once a month to provide consultation to school teams who make a request. And teams can access BrainSTEPS Committee when they would like more in-depth information about resources in the management of a student with any type of head injury. Whether or not the student was born with the head injury or it is acquired. And the committee can also provide resources regarding professional development, offerings from the CDE or other community agencies, and the district training regarding assessment of a traumatic brain injury. As I had mentioned, this is the list of the committee members featuring at the very beginning, Dr. Stephanie Crawford and Dr. Kayleen Case, Cindy Stephenson, Abigail Romans, Patty Kreinbrink, Alyssa O'Brien, Nikki Sims Taylor, Carrie Bilby, and Dr. Peter Thompson. So thank you to all of you for what you do. And lastly, in terms of BrainSTEPS, nurses lead the building level concussion management in the acute phase, and the committee members provide consultations for prolonged or severe difficulties due to brain injuries, such as Chris had mentioned in his presentation. So although this webinar was pre-recorded, I want anybody who's watching it to know that you can still ask questions, and I will do my very best to get answers for you. You can send me an email at arisso2@dcsdk12.org, and I am happy to pass on any questions that you have to our experts and our panelists from today's webinar. And lastly, I wanted to update everyone on our next Parent University webinar. It is planned for October 25th, 5:30 to 6:30, and the topic is career pathways, post-secondary readiness, and concurrent enrollment, including a day in the life of a legacy campus student. So that should be a really fun webinar full of next steps after high school, essentially. You may look for additional updates about this particular webinar and any other webinars that we have with Parent University to be posted on our social media, our district emails, our district website, and also our primary event platform, eventbrite.com. So please look for any additional information. Furthermore, if you are following eventbrite.com, you will receive automatic updates about our upcoming Parent University webinars. Thank you for taking the time today to learn about the concussion protocol in our school district and the very good care that is taken care of our students by all of our professionals and experts. Please reach out once again to me at my email, arusso2@douglas-county-school-district-k12.org, if I can answer any questions. And thank you for attending. We will plan on seeing you during our next Parent University. Good night.